Hi guys, this video is about abdominal tendinopathy and I'm going to look at why it develops, who gets it, and then also what treatments are useful, and I'll show you some good starter exercises for it that I tend to find useful. Excellent. So those of you who don't know me, I'm one of the physiotherapists from sportsinjuryphysio.com, where you can get online physiotherapy assessment as well as treatment of your sports injuries. So have a look at the description of this video if you would like a link to our website. Good. So abdominal tendinopathy, who gets it and why do we get it? So I want you to look at the anatomy of the pelvis and the abdominal wall and everything first. So what you're looking at there is, you see the pubic bones coming together there, and you've got your rectus abdominis muscles coming in and touching from the top, and then you've got your adductors feeding in at the bottom. So where is this area? Let me just show you on myself. So if you want to find your pubic bone where they attach, it's literally this bone at the front where you can feel that's your pubic bone. And if you go side to side, you'll feel there's a little gap in the middle. That's your pubic symphysis. Now, if you come up from that, this is where your rectus abdominis, or your six-pack muscles, attaches into. And then your adductors come and attach into that bit. Now, why am I showing you this picture? Because your abdominals work very closely with your adductors. They kind of pull against each other in a team as you do sports. And very often, if you've got an injury to your abdominals, the adductors will also be injured. Or if the adductors are injured, they can cause the abdominals to strain. They all work in a unit here, so it's important to understand that connection. Also, so because the abdominal tendons attaches to the top of the pubic symphysis there, you get the pain from abdominal tendinopathy tends to be usually starts to one side more, but in severe cases, it then crosses over and both sides become painful. It can refer pain into the abdominal wall, so coming up. It can refer pain into the adductors because of that connection. And it can also refer pain into your genital areas. So if you have pain in that area though, it's really important to just go check with your doc that they rule out anything else that could cause pain in that area. So thinking bladder infections, hernias, stuff like that. So a visit to the GP is always good to just rule out those things. If you want to be sure about your diagnosis, the best way to see these things is either ultrasound scan or MRI scan. MRI scan would be my preference if you can access that, because then you can see the state of your pubic symphysis as well as your adductor tendons and things as well. Because you may have stuff going on in there whilst you only have abdominal pain at that point. The other important thing that you need to remember is that area it's not very often that you just strain one part. So who gets abdominal tendinopathies? You'd think that it's somebody who does a lot of ab work, core training in the gym. But no, it's actually people who take part in running sports, especially if there's a lot of twisting and turning. So it's typically footballers, hockey players, basketball players, but also long distance runners. And often if somebody has osteitis pubis, where it is a chronic injury or breakdown of that wear and tear basically of that pubic symphysis area, you'll get that the abdominal tendons is also affected, and often the adductors as well, because it's basically high strain through that area that has weakened it all and it just overstrained. Another group of patients who can get this is actually after giving birth. So women, not necessarily linked to sport, but after delivering a baby, they can have this, because obviously that puts a lot of strain on that area as well. What am I forgetting that I wanted to say in this bit? Okay, so that's basically what it feels like, who gets it. Now, how do you get it better? So you've got to remember that this is an overuse injury. So you have to be really just mindful of how you introduce exercise to this. Because if you just go and do lots of heavy strength training immediately, you will just overstrain it and it will feel worse. Also, you've got to keep in mind what else you've got going on. So for instance, if you've got pubic symphysis issues in there as well, then you want to avoid anything that puts a big rotation or torsion force through that pubic symphysis initially. It gets added on later on in the program, but for those initial stages, you want to keep things kind of symmetrical. Have a look. I've also made a video, extensive video about osteitis pubis if you want to know more about that, and adductor tendinopathy, because those two things need to be addressed if you've got them at the same time as your abdominal tendinopathy. Now, yes, you can have injections into that area that will kill the pain, but I would actually advise against that. One, because it's usually cortisone that they inject, and we know that cortisone weakens tendons, so in the long run, you've already got a weak tendon there, now you're injecting cortisone in there, great, you have no pain, but guess what? It doesn't make it stronger, in fact it may make it weaker, and you're actually worse off eventually with your rehab. So you have to try at least 12 weeks of rehab before you start using any other modalities with that. But before we get to the rehab bit and the strengthening bit, remember that hand in hand with rehab, load management always goes. Because that area that you've now injured is not as strong as you want it to be to cope with your sport. So if you continue to do your sport and you don't dial it down a bit, you will just keep on making it worse, and you won't see results from your rehab because you're trying to strengthen something on top of what you're spraining it all the time through doing your sport. So you have to reduce your sport back down. And how much you reduce it by will all depend on your type of sport, how severe your injury is, yeah, all of those type of things. So there's not it's not that you have to stop everything necessarily, but you definitely need to dial things down. You want to establish that baseline of your sport that you can do that does not cause an increase in your symptoms. So say for instance, if you're a footballer, it will very likely mean that you need to cut out any, well, matches and things to start with, but also kind of maneuvers where you have to twist and turn. So it will likely mean a break from football for a while, but you may be able to still continue to run to keep some of your fitness. Or maybe even running hurts, then you'll have to replace it with cycling. For runners, you may have to, if it's not that severe, just adapting the speed you run at or the distances you run may already be enough to say, for it to say, yeah, okay, I can cope with this bit. You can keep on running, but just don't run too fast or too far. But for some people, even that doesn't work. If it's really sensitive, then you may have to stop all running for a while and just do some cycling or cross-training or something like that until it's recovered and strengthened enough that it can cope with running. Now, you may wonder, why does abdominal muscles actually work when you run? Well, it's because they feed into those adductors, and I don't know if you've had this injury, and especially if it's very painful, you very quickly realize how much you use your stomach muscles, because coughing and sneezing is usually really painful if it's severely flared up. Just getting up from the bed. So first thing in the morning, you wake up and you go, oh, I'll get up, and you go, oh no, I can't get up like that. I've got to get up sideways. Or just sitting for long periods, keeping yourself upright, reaching for something. You use your abdominal muscles during every single movement. So yes, the first step in your treatment program has to be load management, that you decrease your activities to a level that does not cause pain while you're doing it. And remember, tendons only shows you the next day often that you've overdone it. So check the 24-hour response. You also don't want an increase in your symptoms the next morning. Okay. Then rehab. So essentially, that part of the tendon where it attaches onto the bone is now weaker than what it should be to absorb the forces during sport. So we've got to strengthen it. But the problem is that it's quite sensitive at the beginning. So if you start with abdominal crunches and you really start with planks and stuff, you usually will just end up making it worse. So I find that isometric contractions tend to work really well for abdominal tendinopathies, especially in the early phases. And the one exercise that I find most people can cope with is abdominal hovers, I call them. I have no idea what their actual name is. But basically, let me demonstrate it. Now, I'm on a bed today because I do not have floor space where I can show all of this. All of these exercises are better done on the floor. So do them on the floor, don't do them on a squishy bed. But let me demonstrate. So let me just bring this down a bit. Up. Actually, I can get rid of this one now. There we go. Okay, so what do we do with an abdominal hover? We're in this position and you make sure that your hands are under your shoulders so that your shoulders are happy. You curl your toes underneath your feet and you tighten up your tummy muscles. So all I'm doing is squeezing my pelvic floors nice and gently and just tightening up my lower abdominals. And then I'm lifting my knees a few centimeters off the floor. I'm not going there because that's too easy. That doesn't actually activate the tummy muscles. It's just a few centimeters off the floor. So it's kind of like a plank, but the big difference is you're not putting the lower abdominals on a stretch. So if you think of a plank, let me just do this, otherwise I can't see if I'm in shot. Okay, so if you think of a plank, that's where you go with a plank. Now, that's actually quite hard work because your abdominals are a little bit on stretch and they've got to work really hard. Whereas with this one, because you're not stretching them, they've still got to work, but it's not that high load. So I definitely find that this hover is a much better place for patients to start with. If you're really sensitive, start with 5 to 10 second holds. Then you rest for 5 to 10 seconds and you do about 5 or so repetitions of that, just to test how it reacts to it. So whenever you start with exercises and tendons, always the first day that you introduce new exercises and you know that it's quite sensitive, you've had a few times where you've overdone it and it's just flared up, just do a small dose of it, because remember, we're trying to establish the baseline of strength that it will cope with, and then you can build on it. So check the 24-hour response, how it responds to that. So that hover exercise, once people are comfortable with that, I usually move them onto the plank, and I'll either have them plank on their knees or I'll have them plank the full way that I've just shown you. But I want them to be able to hold that hover exercise for 3 repetitions times 40 seconds to a minute before I progress them to the planks. Because I find usually if they're able to do that, then the tendon is happy to cope with a plank position. And then the same thing for the plank. I build them up from starting with like 10-15 second holds. The shorter you hold it, the more reps you do. So if they're holding it for 10 to 15 seconds, I'll get them to do anywhere between 6 and 10 reps. But as they increase the time, so we're aiming again to get to 45 seconds to a minute, they'll decrease the number of reps. So they'll only do about 3 reps of 45 seconds to a minute. And that's once a day, and not every single day, 2-3 times max a week. Because now remember, you need to give the tendon time to recover as well after exercise. So if you just, it's good to get into a rhythm at this point with high load days and low load days. That high load days you work it a bit harder, and then you give it recovery days. Okay, so that would be my first progressions, and usually people with osteitis pubis also copes quite well with that because it's all straight exercises where there's no uneven forces. But then as they get better with the planks and stuff, you can get them to, you can lift one leg off at a time because that puts a bit of rotation force through the pubic symphysis. If we don't have symphysis issues and it's just abdominals, I'll probably move on from planks quite quickly and leave out the lifting of the leg stuff, because then we can bring in rotation much more quickly, but it all depends on the patient. The other exercise that I find really, really useful is to do an abdominal curl down, that you make sure you strengthen the rectus abdominis through every single part of the range that they can work through. Let me show you what I mean with this. So the first step again is I want to get people used to isometrics of them first. So I'll get them to do an isometric crunch, but often they don't handle them as well as that hover one I've just demonstrated. So get the hover comfortable first and then test the crunch out of it. So how does an isometric crunch look? Remember, do them on a sturdy surface, not a soft one like this. It's literally, you're in this position, you tighten up your pelvic floors, you just tense your lower abdominal muscles so that now you're going to curl your spine up. So you're going to tuck your chin and look up and just look through your legs. So I'm not trying to lift up or anything. I'm literally lifting my head and looking between my legs. But now when I lifted my head, I made sure that I kept this bit absolutely still. So you tighten up your tummy first, tighten up your pelvic floors, and as you lift your head, this bit doesn't move. It stays flat against the floor or just at the same distance. And you hold that. So you start with 5 to 10 second holds and then you put it back down. And even putting it back down, this bit still doesn't move. Okay, so you've done that, you've built it up, you feel you're quite confident with that, it can handle that. Then, this is a Pilates exercise, but I absolutely love it to rehab rectus abdominis. Get my patients to sit and just tighten up their tummy and curl the spine down. So get into a C curve. So it's not like the hinges you'll see people do, hinging from the hips. That's just your hip flexors working. Don't want to see a hinge. I want to see that they really tighten up the abdominals and get that C curve in there, that you can feel your tummy move working and your lower back touching on first. If you've got a back that's sensitive, it may not like this exercise, so it's best to check with a physio or somebody before you do any of these things in any case. Okay, so then you come down and you really carefully put that down, and you see, can you actually go all the way down without plonking down? And you'll notice my legs stayed flat. They didn't come off the floor at all. Okay, and then you check, can you actually come up? So you look up, tighten up the tummy, and you curl up nice and slow again. Okay, I usually get people to just hook their hands behind their legs so that they help themselves a little bit. So I'll get them to first just touch there, and if you get to this point and you feel you're going to lose it, you just take some weight on there, that you incrementally get it stronger and help it. And same thing for coming up. If you can't get up at the beginning, bring yourself back up first and just practice the down. But if you come up to there and you feel you can't, you just pull gently and you help yourself. Try not to hook your legs under something, because it's too easy to then just use your hip flexors to pull yourself up and down. But you would have noticed there that that's again a nice straight exercise. So if you've got osteitis pubis at the same time as the abdominal tendinopathy, it's a brilliant exercise. Well, remember, not the starter exercise, do the isometrics first, but for the initial stages, because it keeps it straight, no force through the pubic symphysis. And then as you get stronger and you can control it properly, you just load it up by using a weight and stuff on your chest. But that's a long way off. The important bit here is that you have to do the right exercise at the right stage. These exercises are all useful, but if you're going to do it too early on in your rehab, it will just cause you more pain. So it's really good to work with somebody who can actually advise you on that. Now, is there anything else that I need to say about this? I think that's the main stuff. So the big thing is to identify, is it just adductor tendinopathy you've got, abdominal tendinopathy that you've got? If you also have osteitis pubis and adductor tendinopathy, remember you've got to treat it all as a whole. Have a look, I've made videos about those for you as well. But yeah, that's it. So if you've got any questions, you're welcome to ask them in the comments. But if you need more help with an injury, you're also welcome to consult one of us via video call. Link to the website is in the description of this video. Take care.